Yeah, at BGS Global Hospital, so we have done a rarest, cancer surgery. That is the complex tumor involving the inferior vena cava. That is one of the largest blood vessel in the body, which carries impure blood from the lower part of the body to the heart. And we had a 32-year-old lady who came to us, who was referred from ESI hospital for the symptoms of abdominal pain, and there was a mass in the abdomen. And when we evaluated at our BGS Global Hospital, we found to have a complex tumor. And we subjected her to further investigation such as CT scan, whole body PET CT scan, and CT venocavogram. Basically, that's a special investigation to look into the where exactly the tumor, the location of the tumor, and the extent of the tumor. And because since it was a complex tumor, it was located between the kidney and the liver, and involving the kidney and the liver blood vessels. So we exactly wanted to know everything. So that's why we subjected the patient for the CT venocavogram, and we got all the information and found to have a very complex, very rarest tumor. And since it was a complex and case involving multiple organs, so and it's not just a single surgeon can do a surgery. So we needed a team of surgeons. So we formed a team of I'm headed by me. I'm a surgical oncologist, along with the liver transplant team, Dr. Sanjay Govil, and kidney transplant team, Dr. Narendra. So all of us, and including the anesthetist, we sat together and discussed about the case and how to go about it. And since surgery is the main modality of treatment for these kind of cases, so we decided to operate the patient, though it is a very rarest, complex, challenging, and probably we can expect death during the surgery also. So ultimately we decided to go ahead with the surgery. And the surgery we did was removing the tumor along with that involved part of the inferior vena cava, that is about 20 centimeters of the vena cava we have removed, along with the kidney, both the kidney blood vessels. And the liver blood vessels, the tumor was going up to the liver blood vessels, but they were not involving per se. So we need not remove the liver blood vessels. And the resected, that is the removed part of the inferior vena cava, was reconstructed using an artificial vascular graft. So in medical, we call it as a PTFE graft, that is a polytetrafluorourethane, that is a material made up of the graft. So the IVC was reconstructed with that, and both the kidney blood vessels were again reimplanted onto that vascular graft. So it is basically doing a kidney transplantation, both the kidney transplantation for the same patient. It's a reimplantation. And the liver blood vessels, so because we did not remove the liver blood vessels, it was going up to that, so it was not necessary. And even during the surgery, this was very complex, and because we had to take care of the kidney and liver blood vessels, we all the surgeons, we saw that both the kidneys and liver were functioning pretty well during the surgery. And the time also, we decided to do at earliest, looking into the to maintain the kidney and liver function. That doesn't mean we will not compromise the quality of the care. So everything went smoothly. Even during the surgery, there was absolutely no complications. And even these kind of patients usually were kept in the ICU and will be monitored in ICU, because again there will be involvement of the kidney and liver. So we monitored all the systems. So the patient recovered very well. So fortunately, there were absolutely no complications, and we discharged the patient in 10 days. And because this is a very rarest case, probably the second in Bangalore, and even if you look at the world literature, hardly there are few cases have been described in the world literature. And since this is a complex case, so, and even sometimes if you just leave behind the tumor, that what we call it as the tumor thrombus can dislodge from that place, and it can enter the heart, and it can go to any part of the body, and it can cripple the life also. And since it's a cancer, it can spread to any other part of the body, and so since it will be fatal for the patient, so we took this challenging surgery and successfully resected and reconstructed also, and patient is doing fine at this moment. And if you look at the cost of the surgery, and we have done at a very nominal cost, because these are all complex cases, involves a very high cost. But at BGS Global Hospital, this has been done at a very affordable cost as per the ESI norms. Thank you. Dr. Madhu Vaisi. I'm a senior consultant surgical oncologist at BGS Global Hospital.